Good morning, guys. I hope we're all sparkly. A quick little video before the gym. Say hello, Dex. Hello, Dex. Social media is full of clinics, people, non-doctors trying to sell you TRT. Sell you on the concept of just pumping in a bit of testosterone and this will cure all of your ills. It will in fact make you superhuman. It will give you guns without needing to put work in. It will make you a stallion in the bedroom. It will remove all of the stresses of modern day life and you will be a god. Obviously, that is utter nonsense. So, if something sounds too good to be true, it should come as no surprise that it's too good to be true. So you should only go on testosterone replacement therapy if you have a confirmed deficiency and you've looked to address your stress, your sleep, your nutrition and your exercise. People are often shocked when I say, I don't think TRT is in your best interests. What I would do is I would look to address and then come back to me. So I don't ever close the door unless they have normal levels. But if you have borderline levels, why would you subject yourself to a lifetime therapy that's going to cost you money, time, effort, and isn't always plain sailing? It can actually be a roller coaster ride to get you optimized. But what are we trying to do? Are we trying to get you optimized or are we trying to get you normal? Well, we're certainly not trying to get you average because we live in a sick society with so many chunky monkeys. We deliberately pollute ourselves with poisons. We are so far removed from nature. Yeah. Here we go, one more time. So we want to be normal. Normal sounds a little bit boring, doesn't it? But your body is incredible. Not right now, but it could be. If you put the effort in, you will achieve your what? Your reward. Work, work, work. Day, night, day, night, day, night. So, TRT is being sold as this cure-all, fix-all. And there are no dangers to taking testosterone replacement therapy. As with anything, there are risks and potential dangers and benefits. So, can you drink too much water? Yes, and actually you can die from drinking too much water. Perhaps the most innocuous substance on planet Earth, aside from oxygen. If you take rat poison, you wouldn't be stupid enough to take rat poison because you'd know that would poison you. But actually we use it in cardiothoracic surgery as an anticoagulant. So the dose has to be titrated according to effect. Paracelsus, the dose makes the poison. And we need to understand the mechanism of action before we implement these things into our daily life, because everything should be considered. There is no cookie cutter approach. So microdosing testosterone replacement therapy is the most effective way of achieving stable male androgen levels. Daily test SIP and HCG works for the vast majority of patients. The vast majority. Sometimes patients don't get on with HCG. Essentially what you're doing is you're turning the dial up to 11. And if you've got other things that you need to address, that can sometimes lead to a heightened sensation and patients don't like it. But for the vast majority of patients, daily test SIP and HCG is gold standard. What are we trying to do? Well, we're trying to mimic physiology. One more time.